Hi everyone, I'm Pat.gillham. I'm the Director and Specialist Golf Physiotherapist at Driving Performance Golf, which is a golf injury clinic based at Royal Golf in New Malden. I want to show you 4 exercises which will help if you have mid-back pain. So mid-back pain can be quite common. It can be associated around the mid-spine or slightly to the side behind the shoulder blades. And it's quite common in golfers where we have to create a lot of rotational forces. And if you can be quite stiff in that area, sometimes it can jar the joint or the rib attachment to the spine, which then sometimes can cause you pain. The idea is just to get that joint moving as much as you can. And these are 4 exercises that should help you. So the first one is just to really isolate that mid-back position. So you want your bottom leg underneath you, so we fix the pelvis, and then all we're trying to do with this hand is reach underneath ourselves. So you're trying to reach underneath and try and drop your opposite shoulder down, and then reaching up to the top. And all you do is just a minute each side. Just make it nice and dynamic. So you do 1 minute this side, and then 1 minute the other side. The second exercise is in the same position here, with this, again, the leg in the same position, both elbows and hands together. And then in here, all we're trying to do is a cat-camel movement. So you're just trying to push your spine up to the sky, and then you're trying to drop your chest bone to the floor. Push your spine up to the sky, drop your chest bone to the floor. Let me show you in side position. So push your spine up to the sky and push your chest bone to the floor. And again, 1 minute each side, just to try and get that movement through the ribs, ideally. The third exercise, again, in the same position, so super easy to replicate, just need a bit of space. Exactly the same position, hand above you, you're trying to reach with your arm above, going beyond your ear, and then you're trying to push with your heel as long as you can, and then you come back to the middle. So nice and push, and then back to the middle. Push, back to the middle. So we're just trying to get some sideways movements through the ribs, really open up the bottom ribs here and the top ribs here, just to get some gapping and some movement through there. And then the fourth exercise, just with a roller at home, which can be really useful. You want to put it in and around kind of bra strap area. And all we do is have your feet on the floor and your bum stays on the floor. Interlock your fingers and put it into the small of your neck. Once they're in that position, you then want to bring the elbows as close together as possible. And in this position, we're just trying to seesaw on the roller. So you're trying to get movement in the top part of the spine and not trying to get it through the lower back. So the lower back stays still. We're trying to arch through that point at which the roller is attached to our spine, again, for a minute. So those 4 exercises, doing nice and dynamically, not really particularly aggressively, and just for 1 minute each side, and that should give you some changes. If you're still struggling though, feel free to contact me via my website, and we can assess the spine, see how you move, perhaps do some hands-on treatment as well, which can help, and then look to get you back on the course. Hope that helped.